happen in HIPAA, kind of goes through some real scenarios that are happening so we can kind of learn, not make the same mistakes. So, Janelle, you have the floor.
All right. So, we're going to talk about HIPAA privacy and security. Make no doubt, though, that your job depends on your compliance with HIPAA privacy and security. As Bill just mentioned, the ramifications of breaking a privacy or security rule are certainly harsh, and they have to be that way by federal law. So HIPAA's got a privacy portion and a security portion. Really doesn't matter that you understand all the technical parts that go into HIPAA. We mostly want to talk about in the next half hour the things that affect you and your job in particular. All of us are probably aware from the news media about the last Christmas it was Target getting hacked into and the loss of security from Target. Now there's Home Depot, there's JP Morgan Chase, there's the US Bank. They're all having issues with our privacy of some of our information being hacked into. I was at a partner meeting in Denver a couple weeks ago with 200 and some of my fellow partners at Eide, and we went to a large hotel resort type conference center, and when we came home from that meeting we were notified that all of our credit cards had been hacked into, and we found charges on our credit cards from Italy and Spain and whatever. There were large pieces of artwork that were purchased on our credit cards. So it's an issue particular with healthcare because we got the issues of very sensitive information also being included. Both healthcare and finance and banking have got a lot of security in place, but healthcare is lagging behind compared to finance, and so we certainly have some issues there that have to be addressed. If any of you watch a lot of TV, which I do because I travel and I'm in hotel rooms a lot, you may have watched New York Med, the show New York Med. It's Dr. Oz's hospital in New York City. It's a reality show. It's showing a real-time ER. And one of the episodes that we saw was where the ER nurse got fired while they were filming because she had posted on Facebook a picture of the ER after a horrific trauma. And really it was just a picture of the ER with all the stuff on the, the bandages and whatever all over the floor, all the stuff all over the floor. And she said something like, her name was Katie Duke, and she was a real popular nurse too, really good at what she did. But she had said something like, this is what an ER looks like when you've had a major trauma when a subway train hits a gentleman or something. Well, that was enough information so that if you read the newspaper the next day, it was John Smith was killed by a subway train, Train 7 or whatever it was called. So she got instantly fired based upon that post on Facebook. And so that was a good example of what's going on out there in healthcare. There is something called high-tech. High-tech changes. You'll hear people talk about high-tech. High-tech was just an update to the HIPAA rules. And as we go through, I'll talk a little bit about what a couple of those are. It really probably doesn't affect so much what you do in your day-to-day jobs. The other thing that becomes a real issue is laptops and what happens with information that you might have on your laptop. I travel, like I said, a lot. I go through a lot of airline security lines, and when you travel, you have to take your laptop out and you have to put it through the conveyor belt. It comes out the other side. Just about all our laptops look exactly the same. They're all black, they're all square, whatever. I was in Tucson, Arizona last week, and I was going through the security line to get back to Fargo, where I live. And when I was going through the security line, all our laptops were coming out, and everybody grabbed them. And pretty soon we heard a page overhead that said, somebody inadvertently took the wrong laptop, and it was a surgeon who was missing his laptop, and he was freaking out because he had patient information on his laptop that wasn't encrypted. And so he really needed to get that laptop back, and the right one back. My understanding is that all the laptops here in your facility are encrypted. However, thumb drives may not be. So if you lose a thumb drive at this point, and it happens to have patient information on it, then we've got a HIPAA breach. I go to a lot of conferences and I do a lot of educational things, and I often see when we go to these conferences for continuing education where we're sitting in a room and we've got laptops set up all over the place and we're using them for the meeting or for the conference, whatever, and then they say, okay, it's lunchtime and your lunch is going to be in the room right next door, and everybody gets up and they go to this next room. And during that time period, all those laptops sit out there with nobody there while you're in the next room. You got to think about your laptop the same way, and your thumb drives, the same way you think about your purse or your wallet or your cell phone. You would never leave those unattended anywhere, and that's the same thing with HIPAA. HIPAA came into being in 1996 with the Kennedy-Kassebaum bill. And now it's gotten so that people are pretty aware of HIPAA, at least. You know, the general public gets a HIPAA privacy statement from every one of their credit cards or from their insurance companies, along with when they come to the hospital, they get their HIPAA requirements. Since April of 2003, there have been just under 100,000 HIPAA breaches and complaints filed with the Office of Civil Rights. Those are only the ones that required to be reported, and they're the only ones that somebody got around to reporting, so there's probably been many more than that. They figured that over 90% of all hospitals have had a HIPAA breach. We already know that you have had a few. What is protected health information? What kind of information are we talking about? We're talking about information that is created or received by the facility, and it can be in any form. It can be verbal information about a patient, it can be electronic, or it can be hard copy. So it's your medical records, but it's also your conversations in the hallway. Yesterday I came here, this is my 6th session of doing this here, and yesterday when I came here I went to the administration area and they told me just stand here and wait a minute because your room isn't ready. So I just stood there. Now, I'm just standing there. I'm doing nothing but standing there. And I could hear things as people were walking up and down the hallway, as plain as if I was talking to them directly. So you got to be very careful with your conversations. Now, some of those conversations I heard were, I got to go to this HIPAA training. You got to go too? Yeah, I got to go. Well, all right, let's go get it over with. Might as well get it done. Which was fine. I understand completely. But if it had been patient information, you were talking about so-and-so and whatever, or this person in this room, that would have been a HIPAA privacy issue because you were talking about somebody who I could identify as a patient. It is any information, past, present, or future, on the condition of that patient. And the one thing I also want you to note is that the protected health information of a deceased patient is no longer considered protected health information, but only after 50 years after their death. So you cannot discuss a patient who's even been deceased for more than 50 years, until 50 years have passed. Now, it used to be open-ended, at least now they say at 50 years. But nonetheless, be very careful with the information that you're sharing. What are these identifiers? They're the obvious things that you already know about, I'm sure. You know, name and address and social security number. But it's also these other things like a login sheet, patient schedules, x-ray films, prescriptions, telephone conversations, faxes, hallway conversations. If you are talking about or dealing with anything that identifies a patient, then it's protected health information and it falls under the HIPAA security and privacy rules. Certainly, you have to talk about patient care when it relates to treatment, when it relates to payment, or when it relates to operations. So obviously, we need to do that. One of the physicians asked me this morning, he said, well, you know, I know that I'm only supposed to have access to patients that I'm actively treating, but I also do case management, I do some UR, I do some quality. Well, that's okay because that's covered under operations. It's something in addition, but it's all part of those 3 categories. So those are the only times that information can be shared of a private nature. There are certainly some other exceptions out there. The government understands that there are things that you need to be able to report. Anything that has to do with Homeland Security, anything that has to do with child abuse, or domestic abuse, those types of things, funeral directors, whatever, court order. Obviously that information can be shared and you don't need to have somebody sign off to say it's okay to share it because that would defeat the purpose. So there are certain things. One of the things that the new updated high-tech rule allowed was it allowed the facilities to share immunization records with schools when they requested without having to get the parents okay to share those records. So that was an addition in the new high-tech rules. Minimum necessary. You will hear a lot of people who talk about minimum, or talk about HIPAA, talking about minimum necessary. Minimum necessary. A facility must make reasonable efforts to use, disclose, and request only the minimum amount of PHI that's needed to care for your patient. Okay? And the access must be restricted based on your specific role. So it's only on a need-to-know basis. So you have no right to know something about a patient that you don't need to do your job. Therefore, you shouldn't be asking. You should not be asking about what's wrong with so-and-so, or I heard somebody came in during the night, or I saw the ambulance go, what was it? Unless that affects your job, you have no right to know that, and that's called the need-to-know rule. And you have the minimum necessary, meaning that if it does affect your job, you're only entitled to know what the minimum is that you need to know to do your job. So if you work in coding, obviously you need to have the medical record, you need to know diagnoses, whatever. If you work in billing, you may not need to have access to the medical record. You only should be looking at the data that you need for billing. Those are the types of things that get you in trouble, is the need to know and the minimum necessary. Most often your IT system has given you certain access to pay depending on your job. So for instance, if you're in maintenance, you probably don't have access to the medical record of a patient. If you're in housekeeping, you maybe don't have access to the medical record. If you work in long-term care or assisted living, you don't need access to the acute care portion of the hospital patients. So your sign-ins, your ability to get in the system should be based upon your need to know and then the minimum necessary. Let's talk about some potential breaches, I think, because this brings it home a little bit. Employees scheduling themselves or family members for appointments. Certainly, you can call in and schedule an appointment for your kids or for your husband or your spouse or whatever. However, you need to do it in the same way and same manner you would as anybody else on the street coming in for an appointment or whatever. If you work in registration or scheduling, you can't just do that. You need to go through the regular channels of everybody else. Employees accessing their own or a family member's medical record, test results, or diagnosis. HIPAA privacy prevents that. You cannot do that just because you happen to have access to the system. Employees doing their own release of medical records for themselves or family members. If that has to be done from your HIM department, then we need to make sure the person who's doing it is not the person themselves. Providers, nursing, or other staff accessing medical records for patients with whom they're not actively involved in their treatment. You may have heard this morning, it was actually late breaking news last night, they fired 2 nurses that were working in Nebraska in the hospital that had the first Ebola patients, the 2 missionaries, because they were accessing those patients' records and they had nothing to do with those patients. It's just they had the ability to look in the system, so they thought they'd look and see how they did and what drugs they took. They were immediately fired based upon that. Housekeeping, asking nursing why a patient's not going home or why a patient's having surgery. It doesn't matter if that patient is your neighbor or somebody you care about or whatever. Under HIPAA privacy, you have no right to know that and you have no right to ask that question. Ambulance staff discussing details of ambulance runs. That doesn't mean that ambulance staff can't get together and talk about what could we have done better, what should we have done, how this run went. It means that they can't go home and talk about it with their spouse. They can't answer the question when somebody says, oh, I saw the ambulance go out of town, what was that, or who was that? those are the things that they can't talk about outside of the walls of the hospital. Business office staff or coding staff accessing medical records for information they don't need for coding or billing. Staff inquiring about patients that have been admitted and wanting to know their diagnosis. How's so-and-so doing? I hear that all the time. Or I need to call my husband and let him know that so-and-so came in over the weekend and maybe he wants to come in and visit him. That's the kind of information that cannot be shared. An employee inappropriately accessing a coworker's chart. Can't look at that. A fax is sent to an incorrect fax number. That happens every once in a while. All of a sudden medical records show up and it's the grain elevator office. I mean, not a good thing. Release of information sent to the incorrect recipient. An employee writes or blogs on Facebook about their workday, which included a specific patient diagnosis that can link to a patient. My best advice when it comes to Facebook and Instagram and posting is just don't do it and don't ever talk about your work at the hospital. You may be having a bad day or whatever, but that's not the place to write about it. Do not write on Facebook about your job. Someone has hacked into your electronic health record and obtained the Social Security numbers. If you were listening to 60 Minutes not very long ago, where we have all these people that are stealing Social Security numbers and they're filing tax returns on your behalf and taking the refund before you get a chance to file your tax return. So then when you file your tax return, they said, we already sent you your money, what are you talking about? That's what's happening with these Social Security numbers right now. A physician or an employee inappropriately accesses the chart of a celebrity. I don't know how many celebrities come through here, but if they did, and a celebrity can be anybody. It can be somebody well-known in your community, it could be your mayor, it could be your school board, whatever, it could be one of your physicians. Celebrity is just a general term, but it's looking for something that you really had no need to know or any need to read about. When it comes to breach notifications, there is levels of breaches, some breaches being worse than others, and they have a scoring grid that they use. They look at what was breached. You know, was it something really simple and benign, or was it something that was really sensitive, like somebody's got an STD or HIV positive or an infectious disease or whatever, then it elevates its seriousness based upon that. Who got the PHI in the breach? You know, did it go to another healthcare entity that's also under the same rules that you are? Or did it go to the grain elevator office where they aren't under any rules, whatever, and it was private information? Was the PHI actually viewed, or did the person on the other end destroy it right away without even looking at it? So that kind of determines how serious the allegations are. Breaches for under 500 individuals, you have 60 days to report it, and along with that, you usually report your corrective action plan. Breaches that are more than 500 people are affected must be reported immediately, and you need to notify the media outlet. So that's why we knew right away when Target was breached, or Home Depot, or JP Morgan Chase, or US Bank credit cards, whatever. We knew about those right away because they had to hurry up and get to the TV station and print newspapers, whatever, to make sure that everybody knew about it because it's a requirement by law. Regardless of whether it's a breach or not, if the information's encrypted, meaning it looks like gobbledygook if you opened it up and looked at it, then it's not something that has to be reported. So encrypted laptops are good. Now we got to get to the point where we have encrypted thumb drives. Eventually we need to make sure that whenever we're texting or using emails and all those types of things that they become encrypted, because that would help prevent some of this. You probably read about the hospital that had the fax machine that finally broke down and whatever, and they were taking it to the dump, and we found out that fax machines have memories in them of all this patient information of every fax ever received, whatever, and they got a huge HIPAA fine for that. So now all fax machines that get old have to be stripped of that information first. Penalties can range anywhere between $100 to $1.5 million in a year. And there are quite a few $1.5 million breaches, and we'll be talking about some of those cases. They do have some reasonableness that's been built into the law. They will take into account how big you are, what your financial condition is, some of those things. There's no doubt that the larger you are, the deeper your pockets, and the tougher your scrutiny is going to be, because you should have known better. This case in particular that's on the screen is one that was a landmark case. And the reason it was a landmark case is because prior to this, whenever there was a HIPAA breach or HIPAA violation, the hospital or the health system got the fine. When this case went into play, not only did the health system get the fine, but so did the person who committed the breach. This happens to be a physician. He was a physician at the UCLA Medical Center, and he was fired from there for some other performance-related issue. It had nothing to do with HIPAA, but another reason. He was fired from his job, but HR and the IT area did not disable his password to get into the system. So while he was, I don't know, hunting for a job or had a lot of time on his hands, he was accessing the records of some of these celebrities. And they could see that he looked at Drew Barrymore, Arnold Schwarzenegger, Tom Hanks, Leonardo DiCaprio, because they can track that, and they track that. He is getting 4 months in federal prison because he was the first case. Now those lengths in prison are much longer than that. But at that time, he got 4 months, plus the facility got a huge fine, and so did he in addition. 5 nurses were fired at Tri-City Medical Center after hospital managers discovered that they'd been discussing their patients on Facebook. Hospital employee left a phone message with the daughter of a patient that detailed both her condition and treatment plan. The problem with that one is that daughter was an attorney who specialized in HIPAA privacy. And she knew better, and she knew it was an issue. Dental office flagged some medical records with an AIDS sticker so that other staff and patients could see them. Now, you need to do that, there's no doubt. If you're in a dentist's office and you have a dental hygienist and a dental assistant and a dentist, they need to be very well aware when a patient comes in with AIDS, because we have to do some double gloving, some goggles, you have to take some extra precautions. The problem with this one was that it was in big red letters and the whole world could see it because the records were visible, and they said that that was a HIPAA violation. Fax sent to a patient's employer instead of the patient's physician with the HIV status. This was an HIV positive patient who had his regular urologist physician. It was a urology office, and he was going to get a different job in a different city. So he wanted all of his records sent to the physician at the new city where he was moving, and so he could start this new job. So he wanted his medical records to go with him to this other city where he's starting this new job. He gave 2 fax numbers to the clinic staff. He gave the fax number for his physician on the other end, and to send his HIV records and all his medical records. And he gave him another fax, which was the fax to the employer as a new employee, because he wanted to send his TB test, his Mantoux test, to the employer. She faxed him to the wrong places. And so the employer then found out that this was an HIV employee that they were hiring. Information that was private, that should have never been shared, whatever. There's a huge fine on this one. Nurse accesses the medical records of her ex-husband. Can't do that. Once they're an ex, you have no right to that. I don't know why they care, but whatever. I don't want to look at mine. Facility denies a patient a copy of her medical record because of an outstanding bill. One of the things that HIPAA clarified in the high-tech rules was you cannot withhold from a patient their medical record just because they have an outstanding balance at your clinic. They are entitled to those records because they are their records. An OR schedule was circulated to employees via email that contained information regarding upcoming surgery for one of its employees. This was a surgical nurse who was going to have surgery in her own hospital. She didn't want them knowing what it was she was having done necessarily. Their practice in that facility was that on Monday mornings they would send out a surgery schedule to all the people involved that would name the patient and the surgery for all the things that they had scheduled. These were elective surgeries, whatever. Obviously they'd have some traumas coming in. Her name was on there and the surgery she was having, and she wasn't very happy. And we talked about the thumb drives. Okay, those are your compliance officer people, which you already know. Maybe you don't know, so I should probably leave that up. If you don't know, you need to know. Let's talk about a couple of these cases that are out here. For one thing, there's the Health and Human Services has a website called, it's a website that they call their Wall of Shame. And this Wall of Shame website has all these different cases of all the different facilities that have had HIPAA violations. You don't want to be out there. You know, you might be if you have to report one, but you really don't want to be out there. And part of the reason you don't want to be out there is not only can patients see it, because they can, and your competitors can see it, and any other physician who might want to refer to you can see it. And then the other part of it is that anytime you get surveyed or some outside survey or regulator comes to your facility, they check that Wall of Shame before they come so they know if that's something they need to follow up on or to be looking for or to test you on. Always be worried when somebody from the outside asks you a question, because there's usually a reason that goes along with that. Okay, let's talk about a couple of these cases that are out there. This one, like I said in all my other sessions, makes me feel a little bad because this nurse was only 25 years old. So think about the fact, this is a new young nurse here. A licensed nurse pled guilty to wrongfully disclosing a patient's health information for personal gain. She has been sentenced to 10 years of imprisonment and a $250,000 fine. So she's 25 years old, she's going to spend 10 years in prison. She's not going to get out early because these are federal guidelines. They are non-negotiable guidelines. So when you're sentenced for 10, it's 10. You don't get out for parole, you don't get out for good behavior. These are HIPAA, security, and privacy rules. These are federal guidelines. So she's going to be in prison for 10 years. She worked as a nurse at a Northeast Arkansas clinic, which was a multi-specialty clinic in Jonesboro, Arkansas. She's accused of accessing a patient's private medical information on November 26th of last year. According to the indictment, she then shared that information with her husband, who on that same day called the patient. The husband reportedly told the patient he intended to use the information against him in an upcoming legal proceeding. She got 10 years for sharing it with her husband. This other guy, he was employed by the Seattle Cancer Care Center. He obtained a cancer center patient's personal information from the health care record, and he used that to fraudulently obtain 4 credit cards, and he charged $9,000 on the patient's name before they caught him, which was within the same day, but very quickly. This other one, this was a front desk registration person at the Cleveland Clinic in Weston, Florida, improperly obtained Medicare information and other demographic information about the patients and sold that information to her cousin for $5 to $10 for each record. This cousin then improperly obtained the patient information of approximately 1,130 patients, and he filed $7 million in Medicare fraudulent claims based on that information that she got. There was a man who was employed by a billing company. It was a small hospital in Newcastle that used a billing company to submit some of their bills, you know, like they outsourced their ER billing or whatever, to this billing company, and this billing company took the demographic information, which most likely was the social security number, and filed tax returns and took the refund on all of those. You probably heard about the case where the physician was retiring and was transferring all their patients to other other physicians because she was retiring. And the clinic left 71 cardboard boxes in the driveway. She wasn't home for 2 days, and those were records of patients. And it was within 20 feet of a public road and a short distance away from a shopping mall. And there were all live medical records within those boxes. That's a mess of fun. It's going to be out there. A former employee of Tri-City Medical Center removed unauthorized emergency department logs containing the protected health information of approximately 6,500 patients on August 8th. The former employee placed the records at the bottom of a cart he used when transporting his personal belongings from the hospital to his vehicle on his last day. The hospital used the logs in an on-site survey review the day prior to the theft. The former employee took the records to the San Diego office of the California Department of Public Health, and he said, look at, these guys had a HIPAA violation because I was able to walk out with all this information. And he turned the hospital in for a HIPAA violation. The logs contain the full names, dates of service, dates of birth, admitting physician, medical record numbers, diagnosis, admit dates, times patients were admitted to the hospital and transferred, in and out time of the ER. And he's turning them in, saying that, hey, they don't have enough policies or security in place because I walked out with all these and they didn't know. Let's talk about Walgreens. Walgreens is always my favorite story. Walgreens has been ordered to pay $1.4 million in a lawsuit brought against it for a violation of HIPAA by one of its pharmacists. The story begins when a Walgreens pharmacist looked up the records of her husband's ex-girlfriend, whom she suspected gave her husband an STD. Apparently, she found what she was looking for and told her husband about it, who then sent a text message to the ex-girlfriend and informed her that he knew all about the results. The ex-girlfriend did not appreciate this and told the Walgreens pharmacy what had happened. At some point after that, the pharmacist accessed the ex-girlfriend's medical records a second time, and eventually the ex-girlfriend filed a lawsuit against Walgreens, claiming it was responsible for the HIPAA violation because it failed to properly educate and supervise the employee. Walgreens argued that what the pharmacist did fell outside her job duties and therefore they should not be responsible for the breach. The judge and the jury disagreed, and the jury decided Walgreens was responsible for 80% of the damages owed the plaintiff, for a total of $1.8 million. Walgreens has said it will appeal, but looks like they're going to have to pay the money. This is a small critical access hospital, much like yours in Pella, Iowa. It's a client that I do work with periodically. Pella Regional Health Center admitted a security breach last week when it discovered that human error paired with a systems glitch caused patients to receive information about other patients. What happened is that the hospital sent out a statement, a bill to the patient saying this is what you owe us for your last whatever, and along with it went 11 other patients' statements. Now, one would hope that if you got your own statement plus some others, that you would notify the hospital or you would take them back to the hospital. Instead, he went to the local TV station, and it's become a huge issue about HIPAA breach and violation. In northern Idaho, a hospice lost a thumb drive, a laptop computer and thumb drive, and it was not encrypted, and it had hospice patient information on it. They also are going to receive a fine. And they said, even though it was less than 500 people, it says, this action sends a strong message to the healthcare industry that regardless of your size, covered entities must take action and be held accountable for safeguarding their patients' health information. So, got another another breach there. The largest breach ever was community health systems, when approximately 4.5 million patients' information was leaked. It was an attack committed by a Chinese group that accessed personal information, including names, birth dates, addresses, and social security numbers. And the second largest breach was TRICARE. TRICARE's thing is what we used to call CHAMPUS, but it's the healthcare for your military. That breach took place at a military healthcare provider, involved the loss of backup tapes containing personal information from military beneficiaries' electronic records. So, we've got some major issues that go on. Again, I think the two largest issues are what you're posting on Facebook and what you're saying in the hallways and what you're saying once you leave the walls of the facility. Make no doubt that your job depends upon keeping that stuff secure. There was a recent case just in the last week in New York City where a gentleman was traveling on the subway, and for some reason he had patient information with him, and when he got off the subway he forgot that information. I don't know if it was a bunch of paper records or what it was. That hospital is getting a $1 million fine, and now they're waiting for his sentencing and his fine to be determined. But $1 million to that hospital because of that one employee. If you get caught with a breach that you have to put in place, you get put on what they call a 6-year corrective action plan, which means that for 6 years you will have to have an outside entity come in every quarter and test your security of your system. It's a security issue. Interview staff, look at your policies, look at your logs, all those types of things to make sure you're doing things correct. For 6 years you're on that watch, so that's an important thing to remember. Okay, any questions? Are you scared? You should be. I mean, you really do need to be. You have to give a lot of respect to this. Be very careful what you say when you're outside the walls of the hospital. Be careful what you're saying down the hallways, because I could hear you guys talking about me, saying you got to come to this HIPAA training. As easy as you were standing right in front of me. Be careful what you say. Be very careful what you say to your spouse and your families. People ask you a question, your response is, I'm sorry, I can't say anything because of HIPAA. You can blame it on HIPAA any place you want. We're still working on trying to get our pastors and our priests trained that they can't just say whatever they want. They have to have permission before they do that. Do not be taking pictures of things because that also can be a HIPAA violation. Be very, very careful with what people ask you and how you respond. But your typical thing is, if you're wondering to yourself, do I dare answer this question or shouldn't I? Or do I dare ask this question or shouldn't I? You better err on the side of, I'm not going to because I just don't know in particular. Okay? Have a real healthy respect for the privacy of your patient information.
I do have a question.
Sure.
If you have a patient come into the clinic and then they go over to the drugstore to get their medication refilled and the drugstore doesn't have their correct billing information, and they call and ask for that, can you get that to them?
You can share them because that's all in the care of treatment of that patient.
Even though it's not part of our facility?
Right, even though it's not part of your facility.
Okay.
That's in the treatment and care of the patient. And they have to respect privacy also because they're under the same rules.
How about if a patient or the patient's parent takes pictures of your treatment session and posts on Facebook themselves?
One of the physicians asked me that today, not so much about the posting it on Facebook, but they said, what do I do when I'm sewing up somebody and the patient says it's okay to let their sister, mother, brother, child take a picture? And you know, you do have the patient's permission, or may have the patient's permission, and then the family, once they get it, they are now the owner of this. They're not a covered entity. They don't have to fall under the HIPAA guidelines. We really want to discourage that. We really want to discourage, for physician liability, if nothing else. You know, I come from, like I said, Fargo. In Sanford, they don't let you use your cell phones once you get to a certain point, including at some point in some of the ERs, they actually have you deposit your cell phone. They don't even let you take it in. They ask for your cell phone before you go in, partly for physician liability because they don't want them taking pictures. and then coming back and saying the physician did something incorrect. But once a family member has something, or a patient has something, there's not much you can do, because HIPAA only applies to you as a covered entity, meaning that you provide health care, or you are working with somebody who provides health care. Otherwise, it doesn't apply, and it's out of your care at that point as to what we can do with that. Other questions?